Hello and welcome to Buddha Zen Wisdom. Thank you for joining us today, where we take a thoughtful and reflective approach to maintaining and improving our health and happiness. We strive to provide insights and tips that can make your life better, step by step, day by day. Remember, taking care of yourself isn't just about you, it's also a way of showing love and responsibility toward your family and those who care about you. Now, let's dive into today's topic: what your face can tell you about your health. Specifically, we'll be looking at how subtle changes in your facial appearance can signal underlying health conditions, including some that might need prompt attention. Sometimes, what appears on your face may be more than just a cosmetic concern. It could be your body trying to tell you something important. Let's explore this further through the story of Mr. Arthur Green. A morning realization: Arthur's concern. It was a crisp autumn morning in suburban Chicago. Arthur Green, a 65-year-old retired school principal, was standing in his bathroom, meticulously wiping his face with a warm, damp towel. He leaned closer to the mirror and muttered to himself, "Helen, come here for a second. Do you think my jawline looks off? Maybe even a little swollen or crooked?" Helen, Arthur's wife of 40 years, was bustling about in the adjoining bedroom, folding freshly laundered clothes. Without even looking up, she called back, "Arthur, your face has always been a bit asymmetrical. What's new? You're overthinking again. Besides, you eat, drink, and sleep just fine. What's there to worry about?" But Arthur wasn't convinced. He frowned and touched his cheek gently, wincing slightly. "It's not just a look, Helen. It actually hurts when I brush my teeth or touch this spot. Plus, my skin feels drier than usual, almost like sandpaper, and I've got these tiny red bumps that weren't there last week. You don't think it could be cancer, do you?" Helen finally paused her chores, walked over, and examined his face closely. "I don't see anything alarming," she said, though her tone was less dismissive now. "Maybe it's just the changing weather or stress. You've been staying up late reading those health blogs again, haven't you?" Despite Helen's reassurances, Arthur couldn't shake off the growing unease. The idea of something serious gnawed at him, and he decided that it was better to be safe than sorry. Early the next morning, he booked an appointment with Dr. Susan Roberts, a trusted physician at his local clinic. The doctor's perspective. Dr. Roberts had been practicing medicine for over 25 years and had seen countless patients with varying degrees of health anxiety. When Arthur arrived at her office, his apprehension was written all over his face. "Mr. Green," she said warmly, ushering him into her consultation room. "Take a deep breath. Let's talk this through. What's been troubling you?" Arthur quickly recounted the symptoms he had noticed: facial pain, persistent dryness, the appearance of small rashes, and his underlying fear of something more sinister. "Doctor," he concluded, "I know it sounds paranoid, but could this be the early sign of cancer?" Dr. Roberts nodded thoughtfully, her face calm and reassuring. "Arthur, I'm glad you came in. It's always better to investigate symptoms early rather than ignore them. Let me explain something: our faces can act as windows to our overall health. Certain conditions, including some cancers, can manifest symptoms on the skin or muscles of the face. However, the majority of these signs don't turn out to be serious. Let's take a closer look." She donned a pair of gloves and carefully examined Arthur's face, noting the texture of his skin, the placement of the rashes, and the areas where he reported pain. After completing her initial assessment, she began explaining some of the potential warning signs that people should be aware of when it comes to facial changes. Key facial symptoms that shouldn't be ignored. 1. Localized discoloration or swelling. If a part of the face suddenly turns dark, purple, or appears swollen for no obvious reason, it can be a cause for concern, Dr. Roberts began. For instance, patients with nasopharyngeal cancer often report facial numbness or persistent swelling caused by tumors pressing on nearby nerves. While this doesn't appear to be the case with you, Arthur, any unusual discoloration or hard lumps should always prompt a checkup. Arthur let out a small sigh of relief. So, my dry skin and little bumps don't count as this type of symptom? Dr. Roberts smiled. No, it doesn't seem like it. But let's keep going. 2. Non-healing ulcers or persistent rash. When a rash or sore refuses to heal over weeks or months, and especially if it becomes painful, it could indicate a form of skin cancer, such as basal cell carcinoma, she continued. Your bumps seem more like an allergic reaction or irritation, but we'll do a quick biopsy if needed to rule out anything serious. 3. Facial muscle weakness or numbness. If someone notices sudden changes like a drooping eyelid, uneven smile, or numbness in the cheeks, it could point to serious conditions, including brain tumors or strokes. This is rare but requires immediate attention. In your case, Arthur, there's no muscle involvement, which is a great sign. The bigger picture, other facial signals. Dr. Roberts leaned back in her chair and adjusted her glasses. While we're on the topic, let's discuss some other facial changes that can give us clues about overall health. 1. Spider veins around the nose and cheeks. Have you noticed tiny red lines or spider-like veins around your nose or cheeks? She asked. Arthur nodded. I think I have, but I assumed it was just aging. Not necessarily, Dr. Roberts replied. These can sometimes indicate high blood pressure. It's worth checking your blood pressure regularly to rule this out. 2. Pale or dull skin. A pale complexion could suggest anemia or poor circulation, while dull, lifeless skin might point to heart issues. Regular physicals can help catch these problems early. 3. Heavy eye bags. Persistent puffiness under the eyes, especially when unrelated to lack of sleep, could signal kidney issues, she explained. If this happens frequently, it's a good idea to run tests on kidney function. Next steps, diagnostic tests and lifestyle adjustments. To address Arthur's concerns, Dr. Roberts recommended a series of non-invasive tests, including blood work, a skin biopsy, and an imaging scan. Arthur, based on what I see, it's likely that your symptoms are due to seasonal dryness and mild irritation. But we'll confirm that nothing else is going on. Within a week, the results were back, and as Dr. Roberts had predicted, there was no evidence of any serious illness. Arthur's dry skin and rash were attributed to environmental factors and a mild allergic reaction. Relieved, he returned to the clinic for follow-up advice. Preventative measures for everyone. Dr. Roberts shared these tips with Arthur and encouraged him to share them with his family and friends. 1. Sun protection. Overexposure to UV rays can accelerate aging and increase the risk of skin cancer. Always wear sunscreen and consider wearing a hat during outdoor activities. 2. Healthy diet and hydration. A balanced diet rich in fruits, vegetables, and lean protein supports skin and overall health. Stay hydrated, especially during dry seasons. 3. Regular checkups. Annual physicals and routine screenings are crucial. They help catch potential problems before they escalate. 4. Stress management. High stress can manifest physically, including on the face. Practice relaxation techniques like yoga or meditation. Arthur's takeaway. As Arthur left the clinic, he felt a renewed sense of gratitude, not just for his clean bill of health, but for the opportunity to learn more about how to take better care of himself. Helen, he said that evening at dinner, I may have worried a bit too much, but I'm glad I did. Turns out, keeping an eye on changes in your face can really tell you a lot about your health. Closing thoughts. Your face can indeed act as a mirror to your body's internal health. While not every change is a sign of something serious, paying attention to the details can make a big difference. Regular checkups and a proactive approach to health are your best defenses against potential problems. Remember, Prevention is always better than cure. Thank you for spending time with us today at Buddha Zen Wisdom. Don't forget to subscribe to our channel for more insights and tips that help you live a healthier, happier life. Let's grow, thrive, and age gracefully together. See you in our next session.